Sometimes, I imagine more women than men, they go out, they have a nice evening, they start laughing, they feel their underpants is wet, they lost control. Is that such a possibility, that as you get older, you sometimes lose bladder control?
Very common in women to lose the bladder control. What you're describing right now, laughing, sneezing, changing position, lifting, bending, and coughing, is usually stress incontinence. It's called stress. And what happened is that most of the time, this happens on women that had labor. They have done some studies, and they have shown that women that have children by C-section, cesarean section, do not develop stress incontinence because they do not destroy the pelvic floor. As long as you allow labor to somebody, you increase the chances of having this thing. The other thing is that they found also that this comes in families. So if your mother has bad stress incontinence, you have to tell the daughter that if she gets labor, her chances of getting stress incontinence is better than 80%. So maybe she should consider a C-section. That's the type of incontinence which is associated with laughing, coughing, moving. The other type of incontinence is called the urge incontinence. Urge incontinence is usually a neurological disease. It's an irritation of the nerves that go into the bladder. And it's usually the key in the door type of syndrome. When you get to your house, when you put the key in the door, you feel like you have to run. You're washing the dishes, you feel like you have to run. You go to the toilet, usually this woman, before they get their panties down, they start urinating and they start wetting. And then once you get a bladder contraction, they cannot control this thing. Usually the people that they have urge incontinence, which is the one that gives you the contraction of the bladder, uncontrolled bladder contraction, they usually are more wet than the one that have the stress incontinence.
Are these treatable?
They're treatable. Either one of them is treatable. The stress incontinence depends on what the severity of the stress incontinence. If you're leaking with a very low leak point pressure, as a matter of fact, the urologist is always going to work this woman, and they're going to do something which is called the urodynamics. The urodynamics is going to show you whether or not you have an unstable bladder. The muscle is unstable. The definition of unstable
but you use the term, when you say urodynamics, what do you mean?
Urodynamics is the study of the pressure, the flow, the volume, and the electrical conduction of the nerves into the bladder.
And from
it's
this,
a computerized test.
You make a conclusion.
Right. You check the intravesical pressure, intra-abdominal pressure, check the rectal pressure, you check for leaking, and the volume that you urinate, and the flow of the urine.
Once you made a diagnosis, how do you treat this?
The stress incontinence, if it's somebody that has a leak point pressure of less than 50 cc's of water, that's usually a bad one. They're very wet all the time. Whenever with any little tiny movement over there, they're going to leak out a lot. Those people are going to need surgery. And the surgery right now, it depends. If you have a cystocele, the bladder is dropped, you have to correct the cystocele, and you have to put like a mesh underneath the urethra, which is mid-urethral support. That's the best result right now. And those things, the operations are usually, they're done through the obturator, which is down through the bones over there in the pelvis. You put the mesh, and they're very quick procedures. And the improvement of that thing is up to about 95% of them. They improve. If the leaking is about 80 or 90, that means that it's not that bad. Usually one of the medications that works very well is usually the cough medicine. Anything that contains Sudafed, Actifed, neosynephrine, phenylephrine. That medication usually is going to tighten your urethra and it's going to make you stop. If it's very little, if they had some kind of a surgery and they're still incontinent, you can try some bulking agents. Bulking agents are very good. And it's done through the cystoscope. And you put a needle and you put a certain substance over there that's going to give you like a cushion. At the level of the urethra, it's going to cause something which is called, in terms, coaptation. The urethra is going to close. And by closing that thing, it's going to create resistance. And it's going to prevent you from leaking it out. Now, the urge incontinence, on the other hand, is treated with something that's going to relax the muscle of the bladder. The muscle of the bladder is the one that is going to contract, and once it starts contracting, you can't stop it. It's going to stop only when the bladder has finished contracting and you have leaked all the urine out. Those people, that's why they're very wet. The stress incontinence, when you stop with the coughing or the effort, usually stops so you can hold it, and they leak a little bit. With the urgent continence, the bladder, once it starts contracting, it does not stop until it empties. So you leak a lot, and you lose the urine. Those people usually, they are treated with anticholinergics, which are the medications. There are a whole bunch of them there in the market, and they're treated, these people over there. One of the things, the drawbacks of these medications, is that they cause a lot of constipation and dryness of the mouth and slight blurred vision. Certainly elderly people, they cannot take this thing because they get a little bit of mental confusion. But there are certain medication that instead of being anticholinergic, they're quaternary amines, which is a different type of medication and can be given on certain people with Alzheimer's disease or senile dementia, which are a little bit confused.